4D CT scanning is a medical imaging technique that captures both spatial and temporal data. It provides doctors with a real-time, dynamic view of a patient's anatomy, enabling them to assess how organs and tissues function over time. One of the key advancements in the future of 4D CT scanning is improved accuracy. By capturing motion data, doctors can obtain more precise and reliable information about the functioning of organs. This can lead to better diagnoses, treatment planning, and monitoring of diseases. As technology progresses, new applications for 4D CT scanning are being discovered. For example, it can be used to study cardiac motion, evaluate lung function, and assess conditions such as Parkinson's disease. The future of 4D CT scanning also focuses on enhancing the patient experience. With faster scan times and improved imaging techniques, patients can spend less time in uncomfortable positions and undergo scans with minimal disruption to their daily lives. Artificial intelligence, AI, is revolutionizing healthcare, and 4D CT scanning is no exception. In the future, AI algorithms can assist in analyzing the vast amount of data generated by 4D CT scans, helping doctors make more accurate and efficient diagnoses. The future of 4D CT scanning holds great potential in the field of surgical planning. Surgeons can use dynamic imaging to simulate procedures, evaluate potential risks, and determine the most effective approach before stepping into the operating room. In addition to improved patient care, the future of 4D CT scanning opens up advanced research opportunities. Researchers can analyze large datasets to gain insights into diseases, study treatment responses, and develop innovative therapies. As technology advances, we can expect to see smaller and more portable 4D CT scanners. This could revolutionize healthcare in remote areas or during emergencies, where access to traditional imaging facilities may be limited. Real-time guidance is another exciting prospect for the future of 4D CT scanning. It can be integrated with surgical navigation systems, helping surgeons precisely navigate instruments during complex procedures, improving outcomes and reducing risks. The future of 4D CT scanning also emphasizes quantitative assessment. By capturing motion data, doctors can measure and analyze parameters such as blood flow velocity, tissue elasticity, and organ deformation, providing valuable insights for personalized medicine. 4D CT scanning can be seamlessly integrated with other imaging modalities, such as MRI or PET scans. This multimodality approach can provide a more comprehensive understanding of a patient's condition, enhancing diagnostic accuracy and treatment planning. While the future of 4D CT scanning is promising, there are still challenges and considerations to address. These include the cost of equipment, training healthcare professionals, and ensuring patient safety and privacy. 4D CT scanning is a revolutionary technology used in medical imaging to capture detailed images in real time. It takes the traditional 3D CT scan to a whole new level by adding the dimension of time. Who knew CT scans could be so trendy? Imagine you're watching a time-lapse video. That's essentially how 4D CT scanning works. It takes a series of images in rapid succession, creating a visual story of what's happening inside the body. It's like a medical filmmaker capturing the inner workings of your organs. 4D CT scanning plays a crucial role in diagnosing and monitoring various conditions, especially those involving motion. It allows doctors to visualize organs, blood vessels, and even tumors in real time. Plus, it helps in planning surgeries and radiation treatments with greater precision. It's like having a superpower to see through the human body. Apart from the obvious coolness factor, 4D CT scanning offers several benefits. It reduces the need for invasive procedures, provides more accurate and detailed images, and helps doctors make more informed decisions. Plus, it saves time and ensures patients receive the most effective treatment. Now that's what I call a win-win. 4D CT scanning is widely used in various medical fields. For example, in cardiology, it helps assess heart function and detect abnormalities. In oncology, it aids in tumor detection and monitoring response to treatment. It's also used in radiation therapy planning, respiratory studies, and even to guide needle biopsy procedures. You lie on a table that slowly moves through a donut-shaped machine called a CT scanner. As the scanner rotates around you, it captures a series of images from different angles. It's comfortable, painless, and over before you know it. Just a few minutes of stardom for your organs. Before the scan, your doctor might instruct you to avoid eating or drinking for a few hours. Depending on the area being scanned, you may need to change into a hospital gown and remove any metal objects. Oh, and don't worry if you feel a bit nervous. It's completely normal, but trust me, you're in good hands. Like any medical procedure, 4D CT scanning has some risks and limitations. The radiation exposure is minimal, but it's important to be cautious, especially for pregnant women or those sensitive to radiation. You might be wondering what the fourth dimension is when it comes to 4D CT scanners. Well, besides the three spatial dimensions, 4D refers to capturing images over time. This means that the scanner can create a sequence of images to observe the movement and function of organs or tissues. Let's break down how a 4D CT scanner works.
During a CT scan, the patient lies on a table that then slides into the scanner. As the patient enters the scanner, the integrated X-ray source rotates, continuously emitting X-rays that penetrate a given part of the body from every angle. Organs and tissues in the body attenuate the X-rays to different degrees. The rays that pass through the body hit detectors and are converted into electronic signals. These signals allow the computer to calculate an image.
Now, you might be wondering what the fourth dimension is when it comes to 4D CT scanners. Well, besides the 3 spatial dimensions, 4D refers to capturing images over time. This means that the scanner can create a sequence of images to observe the movement and function of organs or tissues. Let's break down how a 4D CT scanner works. Firstly, the patient lies on a motorized table that moves slowly through a donut-shaped scanner. As the patient moves, the X-ray tube rotates around them, emitting a series of X-ray beams. These X-ray beams pass through the body and are detected by radiation sensors on the opposite side of the scanner. The information is then processed by a computer to generate detailed images. After the X-ray beams have passed through the body, the computer uses a technique called image reconstruction to create cross-sectional images. It does this by analyzing the differences in X-ray absorption throughout the body. By capturing multiple images over time, the scanner is able to reconstruct a 3D model of the moving structures within the body. One of the key applications of 4D CT scanners is studying respiratory motion. By synchronizing the image acquisition with the patient's breathing, doctors can observe how organs such as the lungs or liver move during the breathing cycle. This helps in the diagnosis and treatment planning of conditions relating to breathing and motion. Another advantage of 4D CT scanners is the ability to perform dynamic imaging. This means capturing images at different stages of a dynamic process, such as blood flow through vessels or the movement of joints. It provides valuable insights for studying both normal body functions and various medical conditions. Concerns about radiation dose in medical imaging are always on the table. However, 4D CT scanners employ advanced techniques to minimize the radiation exposure during imaging. For example, they can adjust the X-ray beam intensity and limit the duration of exposure, ensuring patient safety while still obtaining high-quality images. 4D CT scanners find extensive applications in the field of cancer treatment. They are used to precisely target tumors during radiation therapy, as they enable doctors to visualize the tumor's motion due to breathing. This accuracy ensures that the radiation is delivered directly to the tumor, sparing healthy tissues in the surrounding area. With continuous advancements in imaging technology, 4D CT scanners are becoming even more precise and efficient. Manufacturers are constantly working on improving image quality, reducing scan time, and enhancing patient comfort. These advancements are revolutionizing the way we diagnose, monitor, and treat various medical conditions. While 4D CT scanners offer significant advantages, it's important to address their limitations. One limitation is the increased radiation dose compared to traditional CT scanners. Additionally, imaging moving structures requires precise synchronization, which can be challenging in certain cases. It is crucial for healthcare professionals to carefully evaluate the benefits and risks before opting for 4D CT scans. Let's discuss the limitations of 4D CT scanning and why it's important to be aware of them. Before we delve into the limitations, let's first understand what 4D CT scanning is. 4D CT scanning is a medical imaging technique that allows doctors to capture images of moving organs, such as the heart or lungs, in real time. One of the main limitations of 4D CT scanning is its limited resolution. While it provides valuable insights into the movement of organs, the images obtained may not have the same level of detail as traditional CT scans. This can sometimes make it difficult for radiologists to make accurate diagnoses. Another limitation is the exposure to radiation. 4D CT scans involve multiple scans taken over time, which means patients are exposed to increased amounts of radiation compared to traditional CT scans. It's important for patients to be aware of this risk and for doctors to carefully consider the necessity of performing a 4D CT scan. 4D CT scanning is not as widely available as traditional CT scanning. This limitation is due to the specialized equipment and expertise required to perform and interpret the scans. As a result, not all medical facilities may offer 4D CT scanning, limiting access for some patients. 4D CT scanning can be uncomfortable for patients. The process usually involves lying still for a prolonged period of time while multiple scans are taken. This can be particularly challenging for patients who have difficulty remaining still or suffer from claustrophobia. 4D CT scanning is primarily used for studying the movement of organs. While it is incredibly useful in certain cases, its applications are limited compared to other imaging techniques. For example, it may not provide detailed information on the structure of the organs. Artifacts can be a challenge in 4D CT scanning. These are abnormalities or distortions that can appear in the images due to various factors, such as patient motion or equipment limitations. Radiologists need to be aware of these artifacts to avoid misinterpreting the scans. Interpreting the images obtained from 4D CT scanning requires specialized knowledge and expertise. The movement of organs adds another layer of complexity, making it essential for radiologists to receive specific training to accurately analyze and interpret these dynamic images. The cost of 4D CT scanning can be another limitation. Due to the specialized equipment and expertise required, these scans tend to be more expensive compared to traditional CT scans. This can pose financial challenges for patients who may need multiple scans or do not have adequate insurance coverage. There are alternative imaging techniques available that may serve as better options depending on the specific case. For example, MRI or ultrasound can provide valuable information without the limitations associated with 4D CT scanning. It's crucial for doctors to consider these alternatives when determining the most appropriate imaging approach. Before recommending a 4D CT scan, doctors need to carefully weigh the potential benefits against the limitations and risks. This risk-benefit analysis ensures that the patient's best interests are always prioritized and that the benefits of performing the scan outweigh any potential harm. Despite its limitations, ongoing research is being conducted to improve the technology and overcome its challenges. Scientists are constantly working on enhancing the resolution, reducing the radiation exposure, and addressing artifacts in order to make 4D CT scanning an even more valuable tool in medical imaging. It's crucial to educate patients about the limitations of 4D CT scanning. By providing information on its benefits, risks, and alternatives, patients can make informed decisions about their healthcare. This empowers them to actively participate in their own treatment and ensure they receive the most appropriate imaging approach. To overcome the limitations of 4D CT scanning, collaboration among healthcare professionals is essential. Radiologists, physicians, and researchers need to work together to evaluate its limitations, share knowledge, and identify strategies for improvement. By fostering collaboration, we can advance medical imaging and enhance patient care. In conclusion, 4D CT scanning is a valuable tool for studying the movement of organs in real time. However, it does come with certain limitations, such as limited resolution, increased radiation exposure, limited accessibility, and artifacts. It's important for healthcare professionals and patients alike to be aware of these limitations and consider the best imaging approach for each individual case.